Dr. Bavi, the third day blues I think are commonly known to most people. What is the difference between that and postnatal depression?
Well, as you said, third day blues, baby blues, most women get them. More than 95% of women are going to get baby blues. And I think, as you've explained so beautifully in your book, crying, tearfulness, moodiness. But the thing with baby blues is that they settle pretty quickly. Usually within 48 to 72 hours, they've settled. The difference between that and postnatal depression is that postnatal depression actually is far more enduring. Postnatal depression doesn't settle on its own. So if you have postnatal depression, it will persist. It will be there for most of the day, nearly every day. It will last for longer than 2 weeks. So if you start off by having baby blues, or you think you've got baby blues, and if it's still there after 2 weeks, that is not baby blues. That is postnatal depression. Or if you think you've got baby blues, but it's so severe that you're not able to function, if you have thoughts of harming yourself, or if you have thoughts of harming your baby, that is not baby blues. That is something that is serious. And then you have to think, maybe I have postnatal depression. Maybe I should go and get help. Just to summarize, the things that we have to look at are, how long is it lasting? Is it lasting for more than 2 weeks? And secondly, the intensity. If it's so bad that I can't cope, if it's so bad that I can't function, this is something that is more serious than just the 3-day blues. And then we've got to look at getting some more help so that you can get better.
There are women, however, who just don't realize that this isn't normal. And even the people around them may not think that it isn't right for her to be feeling like that. They might just think, well, she's so tired from the birth, she's got so much to do, that's why she's feeling like that. And very often it's somebody outside of the family who might notice it and trying to help. How would they do that? How would they go about putting the message across that this isn't right? Perhaps you should see someone.
Well, I think, for many mothers, for many families, just having somebody else to say, look, I'm worried, I think something is not right, can be a huge relief. Because I think as a mother, I think as a woman, when you have postnatal depression, you know in yourself that something is not right. As mothers, as women, we so often taught that actually we've got to keep it all together. We're really blessed to have this wonderful baby, and we are, but we taught we're not allowed to show anything that's bad. So to have somebody else say to us, listen, I can see it's not great, can I help, can be such a big relief.
Indeed.
And if you're somebody outside and you're worried, even if the person doesn't respond the first time, say it again. I can see things are not great. How can I help? Maybe the person doesn't respond the first time, but the second time or even the third time they might respond to you. Also to say to them, how can I help? Rather than saying, let me do this, let me do that. It's an open-ended thing. It allows that mother to ask for help in the way that is needed, that will actually help her the most.
Yes.
In a more specific way, you could say to her things like, maybe you can speak to your clinic sister, maybe you can speak to your midwife. If you're really, really worried that she's at risk, if you're really, really worried that she's at harm, suggest to her or suggest to her husband, why don't we go to the clinic together? Why don't we go to the doctor together? So that you are there supporting them, yes. Or that, and you've made the step to then actually go through to the clinic with her.
What about the horror of postnatal psychosis?
Postnatal psychosis is such a serious condition. Thankfully, it's very rare. Less than 1% of women will get postnatal psychosis, but postnatal psychosis is one of the true psychiatric emergencies. And it is such an emergency because it places both the mother and her child at such risk. The thing with postnatal psychosis is that women lose touch with reality, and they pose serious dangers to both themselves, their babies, their children and other mothers around them. Very often women with postnatal psychosis, they're agitated, they're restless, they believe things that are not true about themselves, about their babies. This is an absolute emergency. And if you think that your loved one, that your wife, that your sister, your child, your daughter is actually having a postnatal psychosis, you need to get that person to hospital immediately, and you cannot take no for an answer in getting her treatment.
Absolutely. It really is very, very serious potentially, and somebody has to action it. Dr. Bavi, what are the management options of the various types of postnatal depression?
Well, you know, like with all mental illnesses or mental health problems, psychotherapy and medication are the two management options. And any woman, for anything during pregnancy or postnatally, in fact, for any mental health problem, we always like to use psychotherapy either alone or in combination with medication. Particularly for mothers with young babies who are breastfeeding, psychotherapy is our go-to option because of safety issues and also because it's really, really effective. However, for many women, psychotherapy alone is not effective, either because they're too ill to do psychotherapy alone. You know, in order to have psychotherapy, you must be able to engage with the therapy. You must have to have a certain level of drive. You must have a certain level of sort of memory function. And when you're very depressed, you actually just can't do that. Also, you must be able to access psychotherapy. So you have to be able to go once a week, you have to physically be able to get there, and for various reasons like time, money, you know, if you've got a young baby, you might not just be able to get to psychotherapy. So sometimes psychotherapy is just not for practical or for medical reasons a treatment option for depression, which is where medication comes in. And there are lots of medication options which are very, very effective and also very, very safe, because you know, the big concern around treatment in the postnatal period is where many, many women are breastfeeding is it safe for the baby? If I'm breastfeeding, is the medication going to go into my breast milk, or will it affect the baby? So we have lots of antidepressants available, and what we know about many of them is that yes, like any medication, some does pass into breast milk, but the amount that goes into the breast milk is very small, and that for certain classes of medication, the amount that goes into the breast milk is small, and this has no clear bad effect on the baby. Now, I mean, in this talk, I can't cover every single medication, and if you need medication, it's important that you have that discussion with your treating doctor, who will go through that in a lot of detail with you and work out for you what is the best option, the safest option for you and your baby, taking into account your own unique circumstances, and work out together with you what's the best treatment plan.
Yes, indeed. And if I might say, sometimes people think that a herbal or alternative type of assistance in terms of something to take or use is a better option and a safer option. And as we know, that can actually be quite dangerous.
Yes, completely. Because, you know, the thing is with herbal products can be really effective. I mean, it's not that I'm against herbal products in any way, as I'm sure you are not against herbal products in any way either. The problem is that with very few exceptions, herbal products are not standardized.
Yes.
So we don't know what's in each capsule.
Quite.
So, you know, unless you specifically know what's in each capsule or it's been recommended to you by your health professional, it's not safe to buy something off the shelf.
No.
So with anything that you take, whether you're pregnant or breastfeeding, it's important for you to see a health professional and to actually have that discussion with them.
Quite. So one mustn't think just because it says herbal or natural that it's safe to take, particularly during pregnancy and as a medication when you're breastfeeding.
Absolutely.
What are the dangers to the baby if postnatal depression in the mother goes untreated?
Marina, I'm so glad you asked that question, because an untreated depression in the mother is one of the biggest risk factors for developmental problems in children. We know that children of mothers who have untreated depression are at high risk for things like delinquency, poor neurodevelopment, which can mean things like poor reading, learning difficulties, higher risks of ADHD, you name it. Any problem with development is given a bigger risk by a mother who's got an untreated depression. These children are also at higher risk of abuse of any kind. And if you think about it, being a mother's hard. Being a mother's really, really hard. We all love our kids, but it's tough.
Yes.
And if you're a mother who's really, really depressed, your ability to parent is just made much more difficult by your depression.
Of course.
So if your depression is untreated, that's going to have a knock-on effect on your child.
Yes.
So it's really important as a mother to treat your depression. I just want to make it clear, I'm not blaming mothers who are depressed in any way. I was a mother who had postnatal depression. I know what it feels like. I'm not blaming anybody. But if you as a mother are unable to treat your depression or unable to seek treatment for your depression, that doesn't just affect you. It affects your children. And so often mothers don't take medication or don't seek treatment because they think that, I don't want to take meds, I don't want to seek treatment because I want to protect my children.
Yes.
I don't want the meds to go into my breast milk because I want to protect my children. But they don't see the other side, that by not seeking treatment, they're exposing their children to harm. The sad thing about depression is that it's not that there's always risk. It's not a no-risk situation. And whatever you do, in fact, as a parent, whatever you do, there's always some risk involved. But it's important for you as a mother and for you as a parent to work with the people around you to figure out what is the best thing for both you and for your children. And I think also for us as mothers and parents to understand that taking care of ourselves is perhaps one of the best things that we can do for our children.
Yes, absolutely. It's really very sad when you think that with the best will in the world, sometimes parents just do the wrong thing. Dr. Bavi, how long can postnatal depression last?
Untreated postnatal depression can last for years.
Right.
Treated, most people who are treated, within a week to 2 weeks, they start feeling better. And, with treatment, within a month, you can recover. And the hope is that once we find the right treatment, and hopefully we find the right treatment pretty quickly, hopefully our first treatment is the right treatment, you start feeling better within a week to 2 weeks, within a month you're back to normal, and then that's it, you're treated. We put you on maintenance treatment for about 6 months, because the brain takes about 6 months to heal, and that's it, you're better.
Well, that's wonderfully positive, so that's great news.
But the important thing is as well, just to remember that treatment is a collaborative process. It's not an issue of you go to your doctor, you get a script, and you go home. Medicine is not an exact science. It's about a process of you working together with your healthcare provider. So if it doesn't work, if you're not getting better, you need to give that feedback to your healthcare provider. It's about the two of you, or sometimes the three of you, your healthcare provider, your therapist, sometimes more people than that involved, working together, giving each other feedback so that you can find the right medication for you. And keep going till you find the right combination so that you can get better.
So you do have to be in the right hands too. And if you go somewhere and it's not working for you, then perhaps you should get advice, and there might be somebody who has more expertise in that field.
Absolutely. And not everybody can treat every patient. We all have different personalities, we all have different expertise, and it's important to give that feedback. You've got to find a treatment team that you like and that you're comfortable with. Hopefully you find that team the first time around, but if you don't, keep going until you do.
Certainly, that's good advice. Thank you.
Thank you.